Welcome back to another episode of the Behind the Counter Show here at HB Pharmacy. I'm with John, my father, our pharmacist, and one of the business owners, and we are talking today about a topic that is near but not so dear to our hearts, and a topic that maybe you've heard about. There's been a lot of chatter, I'd say an increasing amount of chatter in the last 2 to 3 years on public channels, most recently with Mark Cuban talking about this, even Joe Rogan talked about this a little bit, so it's getting some mainstream attention. And actually, there's bills going on in Congress and the House of Representatives. Every so often you'll hear a presidential candidate talk about it. And what am I talking about exactly, Dad?
We're talking about PBMs.
So what is a PBM? Is that a sandwich I can make when I'm like 5 years old or something?
Peanut butter and marshmallow. No,
right,
it's a PBM, Pharmacy Benefit Manager.
Okay.
So ideally, and originally, a pharmacy benefit manager was there to help ostensibly save money, reduce healthcare costs, save the patients, and maybe perhaps manage their drug therapy better and things like that.
Sure.
None of that is really proven to be true.
A PBM, they work with an insurance company, but we're just going to collectively, for simplicity's sake, refer to PBMs and insurance companies going forward as one and the same insurance companies, even though technically that is not necessarily
Sure,
the case.
It's not, because they're different parts, right? So you have the person that's your insurer, and then they contract with a pharmacy benefit manager to handle the benefits of any pharmacy benefits specifically.
Now, as a patient, this impacts you because this is not only impacting how much you pay for your prescriptions and things of that nature, but it's also impacting which pharmacies you'll be able to use to get your medication and things of that nature as well.
And typically, it's not unusual for a pharmacy benefit manager to eventually kind of funnel you to their pharmacy, their mail order pharmacy.
Right.
An example for some people that may not still be familiar with who a PBM is or what a PBM is, you may have heard of people like Caremark or Express Scripts.
Sure.
So those are some of the PBMs that are
Right. So originally, John's correct. It was done because people assumed, hey, if we have someone specifically focusing on managing these benefits, these formularies for whatever drugs are going on, it'll save money for the system as a whole, and ergo that savings will impact patients as well, and drug costs will be cheaper for everyone. Obviously, that has not happened. You don't need to be in the know with healthcare to know that that's the case or feel that that's the case. So where exactly have things gone wrong? I'm assuming it's been on the consolidation side.
There's a lot of different things. There's so many different backroom deals that go on where, if you've ever heard of the term a formulary, where a drug is, there are many prescriptions for blood pressure or for high cholesterol, for example. And particularly when you had brand name drugs before they went to generic, a pharmaceutical house would want their drug to be on the formulary and perhaps not have their competitors on there. So they would go and go to the PBM and say, we want to be your number one choice. And so what happens when you're the number one choice? Maybe that's called a tier, maybe a tier 3 or a tier 2 type drug, as opposed to your competitor, who they might put as a tier 4. And what does that mean to the patient? You get a lower copay when it's preferred. Then they box out the competition. So why does the PBM do this? Well, they get a rebate from the pharmaceutical company.
Right, exactly.
So the money flows back to the PBM.
And those rebates originally, when this was started, were supposed to flow to pharmacies, to patients, to essentially reduce the cost to the system as a whole, but instead that money is not going.
It's actually
anywhere.
driving up the cost in some respects, because now the pharmaceutical company is now, in addition to doing all that research and development, has to now give what I call, what it is. It's a kickback. It's not illegal by any means, but they're getting that rebate, and that's really costing more money.
So it's partially that, and then on the flip side too, from a provider perspective, you may have heard about, physicians. It's not just in pharmacies. Physicians and other areas of healthcare are having a lot of challenges with reimbursements and being properly compensated by insurance companies for the services we provide. But partially what's happening too is they are reducing the amount, and this is why Congress and the House of politics aside, you hear people from both sides of the aisle talking about this as an actual issue at a national level, because for us, even independently here, we are getting reimbursed not only sometimes very minimal amounts over what our costs for these drugs are, but sometimes less than the acquisition costs for the drugs
it's not uncommon at all to get reimbursed below cost. And with some other things called clawbacks that are going on now, retroactively 3-4 months from the time of the actual filling of the prescription, they're allowed to have these predatory practice of coming back in and saying, we may have paid you $20 for this, but now we're taking back $3 or $4 or $5, so now you're only getting
Correct.
$15.
Think about it this way. Think if you went to your local pizza place, right, and you bought a slice of pizza for $5, probably in Manhattan if that's where you're getting $5 pizza. But let's run with this analogy here. You pay a slice of pizza for $5. Now imagine a month later you go back to buy another slice of pizza, you pull out your $5. The pizza place says, hey, actually we decided that $5 pizza you bought last month, that's actually worth $10, so you owe us an additional $5. So they basically are charging you $10 now for this next slice of pizza. Not exactly how it works, because obviously what happens in healthcare is they owe us money. So instead of paying us the full amount they owe, they just take that out of the amount that they owe for the next month. So it causes, it can cause cash flow issues for a lot of healthcare providers, not just pharmacies.
And that $5 really, in a typical community pharmacy could be hundreds of thousands of dollars annually.
Right, exactly.
Hundreds of thousands.
Yeah, it's crazy. So that's why this has started to get national attention. That's why this is an issue. Now, there were some regulation changes in 2024 that literally just happened in January. So those fees are not going to be retroactively applied anymore. They all have to be applied at the point of dispense now.
Right, yep.
So that at least has been a step in the right direction for everyone involved in the equation.
However, the fees are still there. So
however, the fees are still there.
Yeah.
So
it's becoming untenable to, just like it is in healthcare in general, like you're saying, other practitioners, doctors, general practitioners, it's almost untenable because of the level of reimbursement.
Absolutely.
They're making it so difficult that,
Right, and here we are just trying to help people,
right.
and it's difficult to even.
And we've been here serving the community for since my father opened the store, your grandfather,
like 60 plus years now,
yeah, exactly. So, this year alone, just because of all these fees and everything that's going on, over 30% of independent pharmacies across the country are going out of business this year. 30%.
It's crazy.
Think about that. That's a huge chunk, and that's all because.
And these are your local community members, community, advocates, community, providers, whatever you want to call it.
We're the people that are here to answer your questions, maybe open the store in the middle of the night if you need something. We're also there, part of the community to support.
Careful what you wish for on that one.
Right. I've been there, I've done it, and I'm happy to help people, but, we're also just involved in the community, speaking at senior citizen functions, immunizing people at home, especially during
instead of
the pandemic.
Just pressing a button in a corporate office somewhere in the middle of nowhere and you just get whatever drugs you need at your doorstep, which is convenient in some ways, but on the flip side, are you really getting the level of attention and service that you actually need to possibly even get off the medication that you're taking if you, could find better lifestyle choices or get other, you're really not being, so let's get into this then. So obviously you can tell why we care. It's pretty obvious to see that, but why should you care as a patient and a consumer of healthcare in our country? What are some reasons why patients should care about these PBM rules and what's going on in healthcare?
Well, I mean, number one, you should have a choice as to where you get your prescriptions filled. Like, you should have a choice of where you want to go, to what doctor, what hospital, what facility for testing. You should have a choice of who you want to get your prescriptions from. So there's that. Two, as we mentioned earlier, what this is doing to in reality, forget what the premise was. And the intent, it's driving up prescription costs, and the only people that are making, even the pharmaceutical companies, that some people always say, oh, big pharma is the devil and all this, and you can make your arguments if you want to about that sometimes, but really the bad actor in this whole thing is the middleman. They're basically just cutting off a huge piece of the pie for doing virtually nothing. So they're driving up the costs for healthcare. So that's a big problem. That's why you should care, because this is costing all of us more money for less service.
Right. And if you think about it this way too, what they're doing is forcing you're saying it's taking consumer choice out of the equation a little bit. So in taking choice out, you're taking competition out too, and it's forcing people to a lot of times get mail order because, for the average patient, they might say, oh, well, this is cheaper here, my copay's lower, so I'm just going to get that. I mean, totally an understandable decision, right? But on the flip side, you're not actually talking to anyone, you're not engaging anyone, you're getting a very low level of service. So do you really want to be just taking Lipitor for the next 30 years instead of trying to figure out better lifestyle ways to possibly reduce it or eliminate it entirely if you can, make some lifestyle choices or whatever it might be?
Sure, yeah.
Right? Like the whole point in coming to a pharmacy in your community is you're not only within your community, but you're also getting a broader scope and a broader picture. And perhaps if you only have been going to a chain, you don't realize this, but there are, thousands of independent pharmacies like ours throughout the country that are providing an exceptional level of service and treating the whole patient with their other doctors and providers,
Sure.
of course, but they're offering a lot of additional services, many times for free too, that you wouldn't actually get if you're just sitting at home and getting something in the mail
Sure.
as well.
No, that's all valid points. And then I don't know if you want to jump to this yet, but I mean it also the more you lose the independent pharmacy, a community of pharmacies across the country, the less you're going to get. There's less choices you're going to have. And in an area like ours here, we're in southern Bergen County. There are a lot of pharmacies. There's probably within less than 2 miles. There's probably 12 to 15 pharmacies.
Yeah, I would say like mostly chains,
supermarkets.
Yeah.
So all those. So around here, if we weren't here, and maybe some of our other friends and the colleagues in Kearney and Lyndhurst, I mean, there are other choices, I guess. So
Sure.
you could get here. Do they offer the service that the independents in this area do? No, absolutely
but
not.
you'll get your meds.
But you'll get your meds. The problem is, there are other areas in the country where, due to demographics, a chain won't open because they're like, there's not enough people out here.
Right.
This is not a place where we want to build a store.
Right.
And so they're not there. So you do have the independents out in those areas. Now, if the independents are going to be reimbursed at the low level, really, and negative level oftentimes, that they are being, and being squeezed by these PBMs, or the insurance companies, they're going to be forced to go out of business. Like I just said, a third in this country, and as of January 2024, we're projected to go out of business this year.
Sure.
So what are patients going to do in these more rural areas? How are they going to have access to pharmaceutical care? And who's going to fill their prescriptions?
Yeah. And think about it this way: if you need, a specific example, right? Like again, we're in New Jersey, we're in a metropolitan area, a lot of choices around here. But let's say, and sure, you can argue, in a rural area, maybe I'll just get my mail order script and I'll be fine that way. Well, what happens if you are sick or your kid's sick and you need an antibiotic? You're going to wait in the mail a couple days maybe for that to come in? What are you going to do?
It's not feasible.
Or
you
drive
have to drive
200 miles?
Yeah, some people have to drive an hour and a half
Right.
just to get the prescription filled. It's just, it's unconscionable.
Probably spending more in gas than you are on whatever antibiotic you're getting at that point too.
So yeah, I mean, it's not saving. It's a disaster on so many levels.
Yeah. So what can patients do, if anything, about this issue?
We're trying today to just increase level of awareness as to what's going on behind the scenes and understand, especially because now we do hear occasionally an elected official or somebody running for office, where I never did 10 years ago, I would have never heard of it. But now you'll hear occasionally, hey, these pharmacy benefit managers are really putting the squeeze on people.
Right,
so
now Mark Cuban's talking about
right,
it.
Right, yeah, he made a whole big thing about it because he's more aware of it because now he's in this pharmacy business. He started this.
Mark Cuban, Shark Tank investor, if you're not aware, started basically a generic pharmacy.
Yeah, so
and now he's in the game too.
Right, and so he sees what's going on more than ever, and he's been calling them out, and other people have been doing that as well, elected officials. So we're just trying to raise the level of awareness to you, the consumer, so that you're more tuned into it, so that if you see something going on, or you see that there's perhaps a bill in Congress like there is right now, that you maybe take the time to call your legislator and say, hey, listen, I want you to support this bill, that's going to improve or tighten down or restrict what PBMs can do, because they have too much power now. And to me, it's gotten to the point of almost extortion, honestly.
Sure. And support your local pharmacy, support your local healthcare providers, support your local businesses, no matter where you are. I can almost unequivocally say that at an independent, you're likely going to receive better service than you would. I mean, it's the whole small business world in general. That's kind of the value here and what we add beyond what you would get at a bigger franchise or a chain and that kind of stuff in general. It's service, right?
Yeah.
So support local businesses, especially if you're in some of these rural areas, because, if those options are gone, like what are
what are your choices going to be? So yeah, the point today is to really just raise the level of awareness to everybody to understand what we're up against, what our colleagues are up against, and when you hear those words like a PBM, maybe you'll know a little bit more and understand that and dig in a little bit to really see what's going on behind the scenes.
Sure, and there are a lot of layers to peel in the healthcare cost onion, that. Sure. So this is just one of the many layers and one of the bigger ones that's gotten more attention recently that directly impacts us as well as you. So we figured we would share some thoughts about it. So thanks for joining us, Dad, and we will see you on the next one. If you have any questions about PBMs or just want to say hi in general, we're always welcoming those kinds of outreach as well. Feel free to give us a call at the pharmacy at 201-997-2010, or you can always reach us at pharmacist@hbpharmacy.com. Thanks again for watching, and we'll see you on the next episode of Behind the Counter.
Thanks.